Welcome everyone to our weekly Q&A session with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey. Thank you so much for joining us today.
Of course.
So my name is Dilshad Burman. I am a writer and reporter with CityNews and 680 News, and I will be moderating this chat today. If you haven't seen this before, what we do is we solicit questions from all of our viewers and listeners all week, and we present them to the doctor. She's never heard them before. I have a cache over here, and I'm going to ask them to her one by one. If you haven't had a chance to submit your questions, you can still do so under this broadcast, and we'll try to get to as many live questions as possible. We really encourage you to interact. The doctor is here for you. We've got 30 minutes of her time. Whatever you need to ask her, please ask below this broadcast. We've also got some questions that we've collected over the past weeks because we never have enough time with the doctor. So we're going to try and get as many of those answered as well. So doctor, are you ready to go?
Yeah, let's go.
All righty. So let's start off. Actually, last week we had a question about organ donation. The question was, if a person passes away from COVID-19, can they donate their organs? And the doctor said she would look that up for us. So doctor, what is the answer?
So I did my homework. Yeah. So it depends. If the person died of COVID, they were contagious at the time when they died of COVID, then you don't donate. Those organs cannot be donated. And that's very similar to other infectious diseases. If you die of them, the kidney, the liver, whatever it is, could actually still have the virus, probably still has the virus, and could then infect the person that you're trying to actually save. So, but if you got COVID, recovered, and then ended up dying, and were not contagious at the time, and there was a window, then those organs could still be donated.
Okay, perfect. So now we'll get to our cache of questions that we've had coming in over the week or so. We'll start again with vaccine questions, doctor, because again, top of mind for so many people as we, as the rollout continues. Let's start with Anastasia's question. Anastasia asks, why not vaccinate the population that has been spreading the virus the most? If ages 25 to 39 are the highest, why aren't we vaccinating them first? They seem to be the main source of the spread. And I understand this might be a provincial or federal question, but perhaps we can get the doctor's insight.
Yeah, no, it's a really good question. If we know that while they may not have the serious infection, they may not be more likely to die of COVID, the numbers are highest in those age groups. So why don't we vaccinate them? Well, we want to vaccinate them. If we had enough vaccine, we would certainly use that as a strategy, but we don't have a lot of vaccine. And so right now, while we're kind of waiting for more vaccine to come, the best decision to provide the vaccine is to those who, if they got COVID, would be more likely to get very sick or to die of it. That's the risk. That's the goal right now, is to prevent those deaths and very severe illnesses. The other piece that we've talked about is when I get vaccinated, I protect me. And that piece of, if I protect me, will I prevent spreading it to others? Again, we're waiting for some of that information. And so that's another reason why we're not going ahead to just get at the younger age groups. And that also being said, it's not just the 20s and 30s who are getting COVID. Really, COVID is in actually every single age group. And so you really need a broader strategy as well.
Right, absolutely. And okay, let's go to, we've got a live question coming in, so I'm going to take that one first. And it's actually related to a bunch of other questions we have, which are all about timelines and the vaccine. So Lydia asks, my 95-year-old mother lives with me. I am her primary caregiver. When will she and I be able to get the vaccine? We've got a similar question about when will people in their 50s be able to get the vaccine? How will we be able to make appointments? These kind of questions.
Okay, so probably I'll have more to share next week. A lot of this information is actually being worked on at the provincial level and is going to become more transparent so that people get a better sense for what's next in line. Now, it's not going to give you a cookie cutter to say, okay, in May, you're going to be up, because that's, of course, going to depend on the vaccine. We do know 80 and up who live in the community will be able to get vaccinated next, and that is the next priority. So the 95-year-old mother will be able to get vaccinated next. The daughter who looks after the 95-year-old mother is probably not 80, so probably won't get vaccinated yet, but depending upon age may come up higher on the priority list. As things become more public, then we can talk about that a bit more as well.
Yes, and that's a question we've been getting consistently, is when and how will I know when to get the vaccine? So that's good to know that, coming up next week, we'll have more answers. That's great.
Yeah, who, where, and how. Those are the top three questions. And again, it's a week by week. The other point is, we're expecting more vaccine to come. We are expecting it to come, and that's going to change as well how many we can vaccinate per week.
Right, absolutely. And then let's talk about allergies again. Anne-Marie asks, is there any data yet on the people with severe allergies to food or medication who have successfully received the vaccine without suffering any adverse reactions? When the vaccine was first approved for use, it was recommended that people who have life-threatening allergies should refrain from getting vaccinated. Has that changed? Because Anne-Marie says she is severely allergic to penicillin, but very much wants to get vaccinated, as does her friend who is allergic to nuts, but very much wants to get vaccinated.
Yeah, so good point, Anne-Marie. Yes, the guidance has changed. Early on, there were a few cases of anaphylaxis noted in the UK, and then we got a bit more stringent and said, you know what, if you have any allergy, let's be more cautious. Well, now actually millions and millions of doses have been given worldwide. In the US alone, which are getting the same vaccines as us, 50 million doses have been given. And so we know that we don't actually need to be so stringent. If you have a food allergy, or a medication allergy, as long as you're not allergic to polyethylene glycol or tromethamine, which is in Moderna. Again, these are, you're like, well, what is that? Well, those are very, very specific ingredients. And so if you had an allergy to that, you would know about that. So as long as you're not allergic to those things, you can get vaccinated. Severe food allergies, anaphylaxis to foods. I can speak, some of my colleagues who work with me in the emergency department have severe allergies, were really worried about getting vaccinated and successfully got vaccinated, some without even any side effects. So, so that is a point of relief. I think if you have questions based on your allergies, talk to your doctor about it or your nurse practitioner.
Right, absolutely. So we have a ton of live questions coming in right now, all about the vaccine. Nisha, let's start with Nisha. She asks, what about the nasal vaccine? Is there a nasal vaccine?
Not for COVID, not available in Canada, not that I've heard of. No, there is a nasal flu vaccine. It's called FluMist, and it was actually became more available at the end of fall. So that is an option, and that may still be available, but not for COVID vaccine.
Okay, good for people who are needle phobic like me. Flu vaccine, good to know. Okay, Sona Khan asks, hi, my daughter is 12 and has asthma. Is she going to get the vaccine, or what age can kids get the vaccine?
Right, so kids right now, the Pfizer is licensed until 16, but 12 to 15-year-olds can get it based on an informed consent conversation. We're expecting to get more licensure and study data on children, probably more soon, up to 12. There may be up to even younger kids getting more trials done, but that probably won't be for many, many months from now. So we'll have to wait and see, first of all, when kids are able to get vaccine, whether it's 16, 18, or 12, when their number comes, and who it's licensed to, what vaccine they can get.
Right, absolutely. Let's go to another live question here. I hope I'm pronouncing this name right. Grain asks, can we choose which vaccine we get? I have had anaphylaxis reactions before.
So right now, between the Pfizer and the Moderna vaccine, the only choice between them is if you have a tromethamine allergy, then you can't get Moderna, and then you would go for Pfizer. But actually, both vaccines are pretty well the same, 94 versus 95% efficacy. They have very similar technology. There are slight differences, but from a personal perspective, they are actually quite similar, very similar, actually. And so that's the first thing to note. And then the second thing to note is that you probably won't get choice, not in the immediate future. Whatever vaccine is available at that clinic is what's going to be available. They probably won't have two different vaccines available, but that may change into the future.
Right, okay. More live questions here. Wendy Brown asks, if you already have COVID, do you still need to get the vaccine? So if you currently have COVID.
So if you currently have COVID, you're recommended to wait until you're no longer infectious. You've cleared your quarantine so that it's safe for you to go to a clinic and get vaccinated. But yes, we do recommend that you get COVID because you can actually get COVID again. We know that. And so it's safe for you to get vaccinated again, and we do recommend that. Now, you can delay getting vaccinated when there's a shortage. You could delay 3 months depending upon the situation, but really you have to wait until you're not infectious anymore. That's the minimum.
Okay. And then Maggie Joyner-Stewart asks, why are teachers and EAs not designated essential? They should now be vaccinated because, of course, kids are going back to school.
So again, this goes back to the provincial prioritization, and we've seen in an earlier model that frontline workers were going to be a higher priority than the rest of the population, and teachers were included in that. So we're waiting to hear more information on exactly what that means and where that would land in terms of getting the vaccine.
Okay. Another live question here. David Venning asks, since the majority of the at-risk population is either vaccinated or will be vaccinated soon, wouldn't it make sense now to end all of the restrictions that we have, all of the lockdowns and things, in order to save people's mental health and businesses?
So we're actually all at risk. There is no, and actually a very small proportion have been vaccinated. It's mostly some healthcare workers, long-term care homes and their staff. Pretty much that's what makes up who's received the vaccine. So we need a lot more people vaccinated before we can say the majority of people who are at risk have been vaccinated.
Right, of course. And then another question here, we have talked about this, but let's ask anyway, since Nohemi Leon is asking, when will I be able to get the vaccine? I have a record of asthma.
So it depends on your age. If you're older, you'll probably come, your turn will come sooner. If you're an adult, less than 60 years of age, you'll probably be vaccinated later on, hopefully before the summer. Again, hard to say exactly when.
Is there any consideration, doctor, for people who have these, pre-existing conditions like asthma or diabetes or things like that? Do you think that group will be vaccinated sooner?
So that's what we're waiting for, those rollouts to come out. Is it going to be everyone who has one medical condition? Is it specific medical conditions? We're waiting to see on that. The National Advisory Committee on Immunization put out their recommendations. They put all adults who have a health condition into their third stage. So we'll have to see what Ontario puts out.
Okay. And then another live question here from Deb Jones. I have had 3 brain aneurysms that can't be fixed yet and a bad heart plus an autoimmune disease. Can I or should I get this vaccine?
So should you? I would say yes. It's not contraindicated for you based on what you've said. I would still talk to your doctor about it because you have that autoimmune condition. You have to time your medication based on when you get the vaccine. We don't know if the vaccine is going to work as well in you as compared to others, but it's certainly safe. There's nothing unsafe about it for you. So I would say talk to your it's a good time to talk to your doctor now when you have time to be able to get your questions answered. So when you're eligible, you'll be able to just go ahead and get vaccinated.
Right, of course. And then Angela Sears Cunningham has the same question you've just answered. Is it safe for autoimmune diseases? Are there any additional side effects? So,
yeah, I think it's worth clarifying that it is safe. If you have an autoimmune condition, it is safe. Right. It's just that we don't know if the vaccine is going to work as well in you. Okay. And so that's why we talk about that informed consent, because you need to know that it wasn't actually studied in people who have autoimmune conditions, but it's not considered to be unsafe. It's just how well is the vaccine going to work? Do we need to time it with your medications? Is there a best time to give it? Those kinds of conversations.
Okay, that's a really important distinction to make then, I think, between safety and efficacy, I guess, right?
Exactly, yeah.
Right. Okay, wonderful. And then another live question coming in here from Carolyn. Carolyn asks, when will a non-RNA vaccine be available?
So the next one that that's in the pipeline, like ready to be licensed, is the AstraZeneca vaccine. This is what's called an adenovirus vector vaccine. So it's different from the RNA, completely different from the messenger RNA vaccines, has not been licensed yet in Canada. That you've heard of other vaccines too, so we'll have to wait to see what gets licensed by Health Canada.
Okay, and Doctor, how is the AstraZeneca vaccine different in terms of, it's not an mRNA vaccine?
It's not messenger RNA. So what happens is it's adenovirus vector. So you're using, it's actually a chimp adenovirus vector to attach to some of the protein of the virus to be able to mount a response. And so it doesn't, it works in a different way. And it's actually very, very different vaccine.
And it's not the same as a dead virus vaccine either.
That's right. There are no, it's not it does not take the COVID vaccine and attenuate it or make it dead and give you that. No. So it actually can't give you COVID either. Okay. But rather than giving you the instructions, it works in a different way.
Right. Okay. Lots of live questions today. That's wonderful. Okay. So we have Ken Campbell asks, will we be able to register to get vaccinated on a website or by text or some other method?
Yeah, so we've heard some information that, you know, you'll be able to either register online or through a call center, for example, to be able to book for an appointment. There will be some way to determine, are you eligible, so that not just anyone can book, and then there'll be another verification process when you come to the clinic.
Okay, wonderful. And then we have a question from Glenna Wellington, and it was actually one of our submitted questions as well this week. Do we have to continually get this virus yearly for a few years or every year like the flu virus?
Yeah, we don't know the answer to that. The messenger RNA vaccines are different from our flu vaccines. They're actually very different from our flu vaccines, but we do know that the virus is changing. It changes. We know that. We're seeing the effects of that. And so how well will the vaccine protect if the virus completely changes? We might need then another dose of the vaccine that can do better with a mutated virus. So we'll have to wait and see on that. Yeah.
Okay, and then JG Brown asks, and this is again, we've got two people who asked this question over the week as well. What about the teachers who are not permitted to double mask and have to deal with special needs children who can't mask? How can they better protect themselves, or how can they be safe?
Right. So when you are an employee, you are a worker who works in an environment where you have to protect yourself against COVID, there will be personal protective measures that you will have to wear to take in order to prevent the spread, to protect you, because you shouldn't get COVID when you're working. You should be able to be protected. And so that will include the type of mask that you wear, wearing a face shield. Sometimes it might include wearing a gown or gloves, depending upon the situation. And so the best answer, I would say, is follow up with your occupational health and safety lead to find out what are the personal protective measures that you can take to protect yourself.
Right. And then one more question coming in live here. Joey Piper asks, are the vaccine companies liable for death or side effects?
I'm not clear on the liability right now. What I can say, though, is if you have a severe reaction to the vaccine, the federal government has committed to this National Vaccine Injury Compensation Program. And so, you know, that's well appreciated, because very rarely someone may get quite sick from the vaccine. And so there is supposed to be a program in place to be able to determine, first of all, was the side effect from the vaccine, and then what kind of support can that person receive? Right,
absolutely. And then we have a submitted question here from Wings, who is a regular contributor to our Q&As. They ask, what happens if the vaccines are not effective against the variants and the spread increases? Should we still get this vaccine?
Okay, so in terms of the variants, I mean, we're still learning about the vaccine and the variants. I think it depends on what kind of variants. So we're seeing that UK is using a lot of AstraZeneca vaccine, some messenger RNA vaccine, and they have the UK variants, and still the vaccine is providing protection. In South Africa, we're seeing a different picture. So I think part of it's going to determine what variant is present and is spread, and how well the vaccine works against that particular variant.
Okay, and we have another live question coming in. And Doctor, we talk about this a lot, but just to clarify for everybody once again, Heather Brown Roberts asks, is this a live vaccine?
It's not a live virus vaccine, no. The SARS-CoV-2 is the virus that causes COVID, and that virus is not present in the vaccine. The messenger RNA vaccine gives you instructions to make a spike protein. The spike protein is the one that's on the outside of the virus. The spike protein itself cannot make you sick. But it's enough for your body to say, what is that protein? I'm going to get rid of that protein. By trying to get rid of the protein, your body produces antibodies. And then once you have antibodies, you have them. And so if you see the virus come again, it has those spike proteins. You are now have your own antibodies. Will make more antibodies when you see more of this, and then can fight against the virus.
Right. Okay, perfect. And then another live question coming in here. Vic asks, if we get to 60% vaccination of the population, I'm assuming, can we resume life with masks?
So we don't quite know what is that herd immunity threshold. Is it 60%? Is it 70, 80, 90%? We don't quite know what that is, but we are waiting to see it. I mean, a lot of people are being vaccinated around the world. Vaccination, I mean, COVID cases are declining. Is it because of vaccine? Is it because of season? I mean, there are a lot of things that are going into that, but there's no reason to think that we won't have a herd immunity threshold with the vaccine. Based on the way it spreads and what we've seen with other vaccines as well.
Okay. And then let's go back to our submitted questions here. Susan asks, I suffered from GBS. Is the vaccine safe for me to get without recurrence?
Yeah, so GBS is Guillain-Barré syndrome, and unlike with other vaccines where there can be a higher risk, there does not seem to be an association between this vaccine and Guillain-Barré syndrome. So again, this is Guillain-Barré can be considered an autoimmune condition as well too, and so I would say talk to your doctor about it. But right now, having Guillain-Barré, having had it, is not a contraindication from getting the vaccine.
Okay, wonderful. And then this might be a federal question. I'm going to ask it anyway. Mary asks, why doesn't Canada buy the conventional inactivated virus vaccines instead of mRNA?
So Canada has bought, actually has put orders in for a lot of vaccines. Right now, these two messenger RNA vaccines are the ones that are available. So that's what we have available right now. Yeah.
Makes sense. And then this is a question we get pretty often, so I'm going to ask it. Maggie asks, why aren't we using treatments like ivermectin, which has proven to be effective in some countries? And if the answer is that there aren't studies to prove it, why aren't we investing in the development of a treatment and focusing only on the vaccine?
So the treatments and the trials for the treatments are still ongoing. Again, the drugs that are available in Canada have to be approved by Health Canada. And so if there isn't a licensure for this drug to be used against COVID-19 and for COVID-19 patients, then it's not going to be available and it's not going to be used. So that's the first step that has to occur in order for a drug to be used.
Okay. And then we already answered some of these live. Okay, let's ask this one. Citizen 271828 asks, given PHAC's recommendation for the public to start using 3-layer filtered tight-fitting masks and eye protection, and since N95s are not available to the public freely, should I be wearing my reusable respirator with a P100 filter cartridges and goggles that I use when I work in a spray booth, when I get my groceries? Do those things protect against COVID-19? Yeah, that's the question.
Okay, so I think, going grocery shopping can be a lower risk activity. I think that's one thing to say. So whether you need the level of protection equivalent to an N95 going grocery shopping, as long as you can keep a physical distance, for example, that you don't go when you're sick, like those can all prevent the spread. We do recommend, right now, our recommendation, Toronto Public Health, based on what Public Health Agency of Canada says, is for minimum of 2 cloth layers with a 3rd filter layer if available. And the 3rd filter layer could be you cut a hole in your 2 cloth layer mask and you put a piece of paper towel or whatever it is, and it should be tight fitting. Not too tight fitting, but snug enough to provide protection. And so I think that 3-layer mask is better protection. The studies do show that. Whether you need to go beyond that, I think you have to think about how well are you able to keep that type of mask on. I'm not clear on whether that type of a mask prevents against the spread of COVID, how well it does in terms of droplets. That's what you really want to find out. How much does it contain droplets?
Right, okay. Let's see, we've got more live questions coming in. Charmaine Wood asks, if someone has had both shots, are they safe to visit me without passing on the virus to me?
I would not take that risk. They are protected themselves from getting sick from COVID, for getting severely sick, from dying. They have better protection against that. But we don't know could they get a mild infection of COVID, asymptomatic infection, and spread it to you. We don't know that. And so that's why you and them still need to keep those public health measures. And if you can, don't visit. Don't visit right now to prevent that spread.
Right. Like you've been saying repeatedly, the safest visit is a virtual visit, like we are doing right now.
That's right. Yeah.
One more live question coming in. CK asks, is Canada going to start producing their own vaccine inventory rather than depending on outside providers?
That's a good question. I mean, I'm relying on the news reports just as you are for that. So we'll have to wait and see whether Toronto or Canada will be able to have that vaccine manufacturing capacity available.
Okay, and we'll go back to some of our submitted questions here. We have some really interesting ones as well. So Evelyn asks, if a person is moving back to Canada from the UK and has had both doses of the vaccine, provides a negative COVID test on arrival, do they still have to be retested and quarantined for the 3 days as at the hotel before moving on? Or if not, do they still need to quarantine for a further 11 days at their residence?
Right now, even if you've received the vaccine, there have been no changes in quarantine for travel. Even those who work in long-term care homes and staff are vaccinated, residents are vaccinated, we're still continuing on with the usual measures. It actually even includes that staff in those homes have to be still tested every week. So, until the guidance changes, you should expect that despite your vaccination, you're going to have to follow the full quarantine protocols.
Right, okay. And this is an interesting one, sort of a predictive question, I guess. Sergio asks, what would be the consequences if we let the healthy population under 50 get more exposed to COVID, I guess kind of like chickenpox or something, and concentrate the isolation measures exclusively on vulnerable and elderly until they are vaccinated?
Yeah, I mean, what we've seen is that even young, healthy adults can get quite sick from COVID. And I think you can look around the world. There are places around the world where, even just south of us, where rates of infection have been very high, even among adults. And a lot of people have gotten sick, and still COVID continues to spread. And so I think what we have right now is a strategy where we try and protect those who are at highest risk, like in long-term care homes, like in shelters, for example. But COVID can still come in. And I think you have to recognize that in those places, workers come in, visitors come in. It's very hard to keep them separate and isolated. And I think if we let COVID kind of go through the adult population, you're going to find that some people are going to get very, very sick.
Right, absolutely. And like we've talked about this several times, you can't predict how sick somebody is going to get. A young, healthy adult may get very, very sick, may have long-term effects, which we've been talking about COVID long haulers as well. So you can't really predict that just because you're young and healthy, you'll just get a mild version of it, right?
Yeah, or that you get sick once and now you're protected for life. We actually know that that's not the case. So, that's another important consideration.
Right. And then we have another live question coming in from Catherine Jensen, which is a concern for a lot of people. And we've heard this over and over. Why is the vaccine being promoted and pushed on people so much if there are so many unknowns about the vaccine? We don't know if you're still going to get an asymptomatic reaction. We don't know how long it will protect us. There's so many unknowns. Why are we still promoting it?
So the vaccine is voluntary. Nowhere is the vaccine, is there coercion for the vaccine. Everyone has a choice to be vaccinated. I think what we can say is we've lived with COVID for a long time now, and we know how serious COVID can be. We know how much COVID has impacted our lives, and I think that's a really important reason why people want a vaccine. I think we do know a lot about the vaccine. The vaccine is safe. We know that it works. And so I think that There are a lot of good reasons to get vaccinated. But as with any medical intervention, if it was a new drug to treat even COVID, right, we don't quite know long-term effects because we haven't had it around for a long time. But what we do know with vaccines is, by and large, they are safe long-term. But we can't say that right now until we actually have the data. We do have to be evidence-based about that. So I think it is up to every person to decide when they want to be vaccinated. We know that 75 to 80% of people actually want the vaccine. And so those 20% who have questions are not sure. Well, let's answer your questions.
Right, absolutely. And then another live question coming in from Erin Summer. I guess this is about, restrictions post-vaccination. So if people don't take the vaccine, will workplaces make it mandatory to take the vaccine in order to keep your job?
So each workplace will have to develop their own policies. And so it could become mandatory in some workplaces. That is certainly a possibility. A workplace can do that, but I don't know whether workplaces are going to do that or which workplaces might do that.
Right, absolutely. And actually, that brings us to 1 o'clock. We had so many live interactive questions this time, I lost track of time. Thank you so much, Doctor, for your time once again this week. Thank you to everybody that submitted so many great live questions this week. It was a really great interactive session. We'll have another one next week with the doctor, so stay tuned for that. And where you can submit your questions, we'll have all of that up on our socials very soon. Thank you so much, Doctor.
Okay, bye-bye.
Bye-bye.